Welcome. This is a video from the Rate Review team at the Division of Insurance, which is part of the Department of Regulatory Agencies, or DORA. This video will show you how to get to the filings from the health insurance companies. The filings are what the companies submit to the division for review before those plans can be sold. In this video, you'll not only learn how to search for the filings that are of interest to you, but also how to navigate through the filings and how to submit comments on those filings that the division can take into consideration in its review. The division reviews and approves the plans and premiums submitted by health insurance companies. We look at plans for the individual market, for those that do not get their insurance from an employer. We also look at plans for the small group market. These are plans for small employers with 2 to 100 employees. And the large group market, health insurance plans for employers with 101 or more employees. However, our review of plans that comply with the Affordable Care Act, also known as the ACA, is confined to the individual and small group markets. So this video will focus on those filings in particular. The division has been reviewing health insurance plans for over 40 years. However, in the area of the ACA, that review has taken on additional responsibilities. Some of the key items the division looks at when reviewing the plans are the proposed premiums that the companies have requested. The division needs to make sure that they are neither too high nor too low, and requires the companies to submit their justifications for these premiums. Any changes in the benefits offered must also be reviewed. The plans must meet the federal ACA requirements as well as Colorado standards and mandates. The plans must also offer the essential health benefits as prescribed by the ACA. And the plans must do what they say they do. If it is labeled a silver level plan, then the plan must cover approximately 70% of healthcare costs. Before we go to the division's website to show you how to get to these filings, it's important for you to understand the rough timeline for the approval process each year. Under the ACA, the timeline for review follows a fairly standard pattern each year. In the late spring or early summer, the insurance companies submit their filings for plans and premiums for the next year. This can happen around mid-May, as it did in 2015 and 2016, or in mid-June, as it did in 2017. After a cursory review to make sure all of the items have been included with the filings and that they are complete, the division makes them available to the public for review and comment. This initial review takes a few weeks, so the release can happen at some point in June or even in July. This starts the public comment period. The comment period will typically close sometime in August. After it closes, the division will incorporate comments into its review of the filings when possible. Then in the late summer or early fall, anywhere from mid-September to mid-October, the division releases the final approved plans for the coming year. The public can view that information at that time. The approved plans are also made available to Connect for Health Colorado and the insurance companies so they can prepare for the upcoming open enrollment period that will usually begin in November. However, before we get going, I want to offer this disclaimer. It's important to note that as you progress through our site to find and comment upon the filings from health insurance companies, that you understand that these filings represent only what the insurance companies have given to the division at the time they were submitted. During the comment period, if you are viewing filings for the coming year, understand that these filings are in the process of being reviewed by the division and are not final. So let's get started. We'll start on the main landing page for the Division of Insurance. That address is DORA, D-O-R-A, .colorado.gov, that's G-O-V, /insurance. We're talking about health insurance, so we'll scroll down and under What We Regulate, we'll click on Health Insurance. On the next page, we'll click on one of the 3 main blue buttons, View Health Insurance Filings and Plans. The next page displays the approved plans from previous years. But most people are going to be interested in the filings for the coming year, so we want to click on the link that says Search Health Insurance Plan Filings. Now, this will take people to a page that shows not only the health insurance filings, but the filings for other lines of insurance, such as property and casualty insurance, as well as life and accident insurance. To get to the filings, click the link Access Insurance Companies Filings, Surf Filing Access. This will take us to a site outside of the Division of Insurance. The SURF Filing Access site is maintained by the National Association of Insurance Commissioners, or NAIC, of which the Colorado Division of Insurance is a member. SURF stands for System for Electronic Rate and Form Filing. The SURF Filing Access site is a nationwide database, but the NAIC has worked with the Colorado Division of Insurance to set up part of the system just for Colorado filings. To get started, click on the purple Begin Search button. On the next page, to continue, you must click on Accept to the Terms of Use. The next page is where you will start to enter the parameters of your search. We're going to focus on the filing search and the parameters within the search options box. However, you will notice that there is a button above this box that says Health Plan Binder Search. The health plan binders will not be available until after the plans have been reviewed, finalized, and approved, as they contain all of the information and back and forth communication and revisions between the division and the company, the final revised versions of plans, and even the comments submitted by the public. That is why they are not available until after the process ends. So, focusing on the filing search. Within the search options box, you'll start with business type. Remember, this database is for many kinds of insurance. Today we're interested in health insurance, so click the box next to business type and from the drop-down menu, choose life, accident, health, annuity, credit. Next, you will need to select the type of insurance. Again, many types of insurance are represented in this database. As most people are going to be interested in either medical insurance or dental insurance for individuals or groups, let's focus on those. Click on the box for type of insurance to display the drop-down menu. The types of insurance are listed alphabetically by their alphanumeric codes. For example, if you were interested in dental insurance, you would see the listings for both the individual and group plans, H10G Group Health Dental, and then H10I Individual Health Dental. But we're focusing on individual medical in our example, so we'll need to choose H16I Individual Health Major Medical, as well as HORG02GI Individual Health Organizations Health Maintenance, HMO. We'll click the little squares next to those types. If you were interested in group plans, you can click on the selections for group plans. Also note that since you can choose multiple types in one search, you could look at both group and individual plans in one search, or even medical and dental plans. But again, for our example, we're focusing on individual medical insurance. After clicking those boxes, you would click Close to close the drop-down menu. Next to type of insurance, you should see the words two types of insurance selected, or however many types you've selected. Next, we need to select the company name for the filings we want to see. We need to be careful here because the legal name of some of the companies is slightly, or in some cases, very different from the company's common name. The key is to try and use the simple name for the company while making sure the button Contains is checked. This will allow for a broader search for any filing from a company that contains that name. Why is this important? Because many health insurance companies have two or more companies that fit under the common name. Using this approach of listing the common name and marking the Contains button will bring up the filings from all entities associated with that name. In our example, we're going to use Bright Health Plan. Again, make sure that the Contains button is checked. Don't worry about entering anything in the boxes for NAIC company code, insurance product name, or SURF tracking number unless you have that information. In the Start Submission date, if you want to view filings for the following year, click on the little calendar button next to the field and pick January 1st of the current year so that you can see all of the filings submitted in the current year for the coming year. In our example, we are looking at filings from 2017, so we will use the date of January 1st, 2016, so we see all of the filings from 2016 that were for 2017. You could also leave the Start Submission Date field blank if you want to look at filings from multiple years. You'll just have to be careful you know what year you're reviewing when you start looking at the filings returned in your search. Know that you don't need to enter an end submission date or either the start disposition date or the end disposition date. Then you hit the purple search button. This next screen will show you the filings that match your criteria. Note that for whatever carrier or plan you are looking for, you should see both a rate and form filing. Look under the heading File Type to see the words Rate or Form Filing. If you want to review the proposed rates or premiums for a plan, you would click on the Rate filing. If, however, you wanted to view the benefits for that plan, such as the summary of benefits, then you would click on the Form filing. In our example, only one plan met the criteria, displaying both the rate and the form filings for that plan. However, your search may return multiple plans, and you'll need to find the ones that pertain to your interest. Also, if your search does not return any filings, you may need to go back to your search to adjust the parameters, or the file may not be available to view yet. If you're having difficulties, you may need to contact the Division of Insurance. At the end of this video, we'll provide you with the necessary contact information for the division. Let's start by looking at the rate filing. You would click on the file you want to view. This will bring up a summary of that filing. Know that this is a long page and you'll need to scroll down to see all of it. As we scroll down, the first thing you'll see is that you can submit comments. You would click the Submit Comment button. This will bring up a comment screen. You can submit comments on filings provided that the public comment period is still open. However, you may want to review the file in full before submitting any comments. So we can close that box and see that next there are many attachments. You can view the attachments in these documents in different ways. One, you can simply click on the document itself to open that particular document. So we've tried that with this document, the rate manual and formula, and you can see this brings up an Excel spreadsheet. You can also simply click on the checkboxes for the documents you want to see. So for example, we'll click on these two. And you would then scroll down to the bottom of the screen and click Download Zip File. However, you can also select All for a particular section, and this will put a check mark in all of the documents for that section. You would then need to scroll down to the bottom and click Download Zip File. Depending on your type of computer, the zip file should show up and look something like what you see on the screen.
It's down because there were so many of them. I select all.
Okay, we can close that out. All right, so let's get back to the listing of all the documents in this portion of the filing, the rate filing. In our experience, consumers are typically interested in the rates, the proposed cost of a plan that a carrier is requesting for the next year. So let's go to the rate table or tables in this filing. These will be found in the section Supporting Documentation. Scroll down until you find the rate tables. If there are multiple rate tables, choose the one with the most recent date. In our example, we'll choose the one with the date of July 7th, 2016. We'll click on that one, and we can see that it will bring up an Excel spreadsheet. The initial tab on this spreadsheet is for their Gold EPO non-tobacco plan, and we can see that listed there in the top left. It shows the monthly premium for the geographic rating areas of the state where this plan will be sold for each age from a 20-year-old to a 64-year-old. Looking at the tabs across the bottom of the Excel spreadsheet, we can see tabs for other plans. The next tab is for their Silver EPO non-tobacco plan. Using those arrow keys at the bottom of the Excel sheet, we can see there are a number of plans referenced on this particular sheet. And at a certain point, it also lists the rates for the tobacco plans, rates if an individual is a tobacco user. So we can close out that sheet. We also know that many people want to view the rate manual in the filing. This is the document that shows how the insurance companies develop its rate for a particular plan. We can find this document in the section called Rate/Rule. You can see multiple versions here, but the one not in the gray section is the most current. Click on that one. This will also bring up an Excel spreadsheet. This one shows the base rate for the plan along with the federally allowed factors that can be used to change the cost of that plan. We can see the base factor at the top left. The benefit factors below that, these would be the differences in benefits between the various plans in this category. Then the age factors, the difference in price for each age. Then on the top right, you can see the area factors, the difference in prices for each of the areas where the insurance company wanted to sell this plan, and then under that, the tobacco factor. Under that, you can see an example of how the rate formula arrives at a rate for a specific individual. The base rate times the benefit factor times the age factor times the area factor times the tobacco factor. As an example, they've used a 21-year-old with plan 10002 in Boulder who is a non-smoker. We can now close that. Know that these are the most common items people want to view in the rate filing. Now let's take a look at the form filing. We can just use the back button on our browser to go back to the previous screen that listed both the rate filing and the form filing. So we'll click on the form filing. You can see this also brings up a summary. Scrolling down again, the first section listed, we see that you can submit comments here too, simply by clicking on the Submit Comment button. And we can close that. Again, we see a lot of documents available. You can use the same methods for viewing the documents as you did with the rate filing. Click on the document or check off the boxes of the documents you want to see or hit Select All and scroll down to the bottom of the screen and hit the Download Zip file. With form filings, we find that most people are interested in looking at the summary of benefits. These are the particulars of the benefits included in the plan. As required by the ACA, the summary is an 8-page standard form that is an explanation of the plan. Some people may also want to look at the schedule of benefits, but know that document comes from the insurance company and can run anywhere from 20 to 100 pages, so it requires significantly more time to go through. You can find the summary by scrolling down through the section called Forms. You see it here with the title of Summary of Benefits and Coverage, English. Note that there is also a Spanish version below this. Let's click on that form. One important item to note as you work through this summary of benefits is the presence of brackets. Brackets on the summary of benefits, like those you see here, indicate that the exact language in this portion of the document will vary between the various types of plans. So once you go through that document, you can simply close it. After viewing the various documents in a filing, you may want to go back and submit comments so long as the comment period for the public is still open. Remember that section is near the top of the summary, so you would scroll back up to offer your comments. When you're done looking at a filing, you can use your browser's back button to go back to the list your search generated, or using the buttons at the top, you can go back to those search results, or start a new search, or refine your search using different parameters. Before we wrap up, there are a couple of final tips to help you as you navigate. However, first I want to remind you that, again, it is important to note that as you work through our site to find and comment upon the filings from health insurance companies, you need to understand these filings represent only what the insurance companies have given to the division at the time they were submitted. During the comment period, if you're viewing the filings for the coming year, understand that these filings are in the process of being reviewed by the division and not final. Before we finish, we want to share some tips regarding the company names of some of the health insurance companies in our experience. These are companies that trip people up in their searches or just confuse them as they look at their results. First, there's Anthem, or as some people call it, Anthem Blue Cross and Blue Shield, or Blue Cross and Blue Shield, or the Blues. Well, in Colorado, there are two organizations under the Anthem umbrella, each with a name very different from Anthem. The first is Rocky Mountain Hospital and Medical Service Incorporated, DBA, which means doing business as, Anthem Blue Cross and Blue Shield. And there is HMO Colorado. In our state, HMO Colorado is the wing of Anthem's business for HMOs, or Health Maintenance Organization type plans, while Rocky Mountain Hospital and Medical Service deals with PPO, or Preferred Provider Organization type plans. In addition to the Anthem duo, know that there are also a number of companies with two entities for their HMO and PPO businesses, but who have similar names sitting under the common name umbrella. An example would be Kaiser, which has both the Kaiser Foundation Health Plan of Colorado and Kaiser Permanente Insurance Company. So, no, there are two Aetnas, two Humanas, two Kaisers, two United Healths, and two Rocky Mountain Health Plans, which are in no way connected to Anthem's Rocky Mountain Hospital and Medical Service Incorporated. And if you are searching for dental insurance filings, the largest carrier in Colorado is Delta Dental, but it actually files its plans under the name Colorado Dental Service, DBA, Delta Dental of Colorado. And if you're still having trouble getting to the filings, or can't find what you want, or your search keeps returning 0 filings, contact the Division of Insurance at 303-894-7499. Or if you're calling from outside the Denver area, 800-930-3745. Be sure to let them know that you have questions about accessing the health insurance filings so they can get you to the right people. Thanks for watching.